I'd like to thank you for coming to my video blog. My name is Dr. Greg Vigoren. I'm a dentist, practicing dentist here in Newport Beach. I see patients from all across the country. And today, what I'd like to do is make something that's boring more interesting. And I think the content is valuable in your decision-making process. Very typically, 90% of the patients that I see, we start by taking out or disassembling old dentistry. And the reason we do that is we find leakage and contamination under most of it. And so I just want to show an example of two cases very quickly that demonstrate what we typically see when we photograph everything under high magnification. This is an upper first molar that people typically get between 6 and 7 years old. So this was probably worked on before this patient was 12 years old, and or sometime between 7 and 12. And it has an old silver filling in it. And you can see that the silver filling has areas that weren't covered in the original outline form. And then you can actually see the decay. You don't need an x-ray to see decay in teeth if you're under high enough magnification. So the first thing we do with these teeth is we disassemble. We take out the old restorative material, we take the crown off, and now we can look and see. And when patients ask me, what do I need to do before I look and see? It's like asking the contractor to tell you how bad the leak is before he takes the wall off and looks. So that's the disassembly portion of this. And from this picture, high magnification picture, you can see that there is decay that was left under the original filling. There's a crack that goes through this. You can see these other cracks. And this is a tooth that is very seriously in need of something to hold it together. Once this is cleaned out, though, I can see that the fractures didn't go very deep. I can also see that some of the very deep parts are as much photographic darkness, and we really stop almost when I can see the pulpal tissue. Now, traditionally, people have said if you do that, you're going to have more sensitivity, you're going to have to do more root canals. But after doing 10,000 of these, I can absolutely state that the more bacterial contamination you take out, the less sensitivity and the fewer root canals you have to do. But now we have nice clean borders all the way around this to bond to, and as a result we end up with a stronger tooth because of the bonding. And these things sometimes break down, but we've had fillings like this, composite fillings like this, last 15, 20, 25 years. Not all of them, but I'd rather find out by doing it that way first. Here is another case of two front crowns that had tissue that was inflamed, and you could actually see discoloration on the root. So the first thing we do, again, tissue inflamed, tissue not healthy, next to tissue that's extremely healthy. So when you see that contrast, you know that there is something with the fit of these crowns or leakage of these crowns that's causing problems. And you can even see the decay underneath the margin. Looking at the back, you can see these two crowns. These two crowns were done out of different materials at different times. And when you take off the crowns, you get your first idea of why the tissue was so angry. These teeth with this leakage are like contaminated white slivers, and the tissue reacts to that. The picture of the backside, you can see the leakage, you can see decay, you can see some darkness in the root canal and the post and core that was done that's really not supposed to be there. And on the insides of the crowns, you can see visually just see in high magnification what was causing the inflammatory tissue. As we get deeper into these two teeth, you can see that a metal post and core was put in there, but it looks like it was sunk into a sewer fitting. It's just contaminated. How can that be healthy? And the other tooth had the same thing. It just didn't show quite as much on the surface, but you can actually see black, looks like black mold inside. We see that very, very often. And the root canal just doesn't, under high magnification, doesn't look correct or as well done as we would expect. And this is the same images after we've used hot Clorox to basically kill all organisms in the canal system. And then put in some post and cores, and you can, these are cast gold, but we can do them out of composite and fiber also. But you can see that the tissue has already perked up tremendously. And there we are with just temporaries on, and the tissue's already on the mend. So this is all about taking stuff out from underneath existing restorations. It's, we call it disassemblies and cleanouts, and it's the foundational step of getting permanent, long-term, predictable dentistry. Thank you for coming, and I hope you come to the blog and hear some more of these humorous or boring presentations. Have a good day.